I'm Dr. Gurpreet Padda, a triple board certified physician and clinical commander here at Regenerative. You've been told your shoulder is the problem, but I'm here to tell you that in 30 years of practice, I've learned one absolute truth. Pain is not a diagnosis, it is a signal. And today, we're going to decode exactly what your shoulder is trying to tell you. My flaw and my edge is a curiosity I can't switch off. I saw patients doing perfect rehab, perfect physical therapy, yet their shoulders remained frozen or torn. I had to ask, why? The traditional orthopedic paradigm treats your shoulder like a mechanical hinge in a vacuum. It's an assembly line model that fails when the issue isn't mechanical, but biological. What I found is that chronic shoulder pain is often a metabolic problem wearing an orthopedic costume. Almost nobody makes this connection, and it's why you aren't healing. You can't sleep, you can't reach the shelf. You've done the PT and the injections, but the ache persists. You think your shoulder is broken. It's not broken, it's compromised. If a joint won't heal despite good mechanical care, that is a massive clinical clue. It's telling you the problem isn't just structural. The tissue itself is metabolically starved. Today, I'm going to show you the missing layer. We're going to look at the specific biochemistry sabotaging your tendons and the root cause plan to finally fix the terrain. We have to talk about metabolic syndrome. Most people think of it as a weight or heart issue, but your tendons are some of the first tissues to feel the effects of metabolic dysfunction. A 2023 study in BMC musculoskeletal disorders confirmed it. Even within normal glucose ranges, higher fasting glucose and insulin resistance are directly linked to degenerative rotator cuff tears. The mechanism is glycation. Excess glucose binds to the collagen in your tendons and capsule. It creates advanced glycation end products, AGS, that act like a chemical glue. We don't just look at the joint, we analyze the biological soil. We audit your systemic inflammation, TNF-alpha, interleukin-6, and high-sensitivity CRP. If these markers are elevated, your shoulder is living in a high-octane inflammatory environment where healing is physiologically impossible. This process makes your tissue stiff, brittle, and incredibly slow to heal. It's not just a tear, it's a chemical degradation of the very fibers that allow you to move. This is why frozen shoulder is so tightly linked to diabetes. Some specialists argue a frozen shoulder should trigger an immediate blood sugar check. The connection is that strong. But here is the macroeconomics of your pain. Your shoulder specialist sees a shoulder, not a metabolism. The system is reimbursed to treat the joint in isolation, ignoring the biological soil. The fasting insulin test that would explain why your tendon won't heal is never ordered. It's not on the menu because it's not in the silo. The cause sits one blood test away, unbilled. Meanwhile, our economy pushes subsidized cellular carbohydrates, the cheapest calories available. You are glycating your tendons on food the system pushes, then getting treated by a system that never looks upstream. At Regenerative, we reject the industrial medical model. We stop managing symptoms and start fixing the terrain. You cannot have a healthy shoulder in a toxic metabolic environment. So, what is the plan? We follow a forensic audit of your biology. Step 1, get the metabolic workup that the orthopedic visit skips. We need the real numbers. We look at fasting glucose, but more importantly, fasting insulin and hemoglobin A1C. We check your high-sensitivity C-reactive protein to measure the systemic fire in your body. Step 2, lower the glycation load. You must stop stiffening your own collagen. This means cutting cellular carbohydrates and industrial seed oils. We have to stop the chemical assault. We focus on mitochondrial restorers. If your mitochondria are failing, your tissues aren't breathing. We use mechanotransduction and photobiomodulation to wake up the healing response. There's a metabolic psychiatry component here as well. When your metabolism fails, your brain's energy fails. This brain energy failure lowers your pain threshold, making that shoulder ache feel like a constant emergency. We have to stabilize the mast cells and modulate the histamine axis to reset your nervous system. Step 3, regenerative support. Orthobiologics like PRP or MFAT work far better once the metabolic terrain is corrected. We aren't just injecting, we're reanimating tissue. Step 4, intelligent loading. Once the chemistry is right, we rebuild the structural integrity. We use sub-millimeter precision to ensure we are targeting the exact site of failure. When you fix the chemistry, the shoulder finally gets the permission it needs to heal. The stiffness melts, the strength returns, and you get your life back. We utilize the Regenerative stack, Beyond just injections, we use the Wolverine stack of BPC 157 for tissue repair and mitochondrial restores like SS31 and MOTSC. We are targeting cytochrome C oxidase for mechanotransduction, following the Arndt-Schultz law to wake up your body's innate regenerative intelligence. This is metabolic sovereignty. You stop being a passive recipient of care and start being the clinical commander of your own health. You stop blaming the joint and fix the terrain it lives in. Your shoulder is not failing because it's worn out. It is failing because the terrain has become toxic. At Regen.MD, we specialize in the high agency patient, the sovereign seeker. If you are ready to stop the assembly line medical model and fix the root cause, book a consultation at our St. Louis facility. Stop managing, start regenerating.